Hi, my name's Michael.
And I'm Sarah, and we're both third year medical students at Warwick University. We're here at University Hospital Coventry in Warwickshire.
Today we're going to be demonstrating how to manage and assess an acutely unwell patient using the A to E structure.
It's 4:30 in the afternoon. 74-year-old William Johnson is brought into the ED department by his wife and son due to increasing shortness of breath and drowsiness. He's known to have chronic obstructive pulmonary disease and was diagnosed with a chest infection 3 days ago by the GP. He has been on amoxicillin but doesn't seem to have improved. He is urgently triaged and placed into a cubicle. You are called by the nurse as you pass the cubicle as she is concerned that he has an increasing respiratory rate, is very drowsy and appears cyanosed and sweaty. She tells you that he has a NEWS of 17. Could you repeat that back for me, please?
Okay, yeah, so this is 74-year-old William who has a known chest infection on a history of COPD, and now he has worsening shortness of breath and is feeling drowsy, so I've been asked to review.
Okay, thank you.
Thank you very much. Hi Grace.
Hi, Michael.
Hi William, my name is Michael, I'm a third year medical student. How are you feeling? Okay. William, can you open your eyes to me? Open your eyes. Okay, the patient's not responding, so I'm just going to lie him flat and look, listen and feel for breathing for 10 seconds. Can I get some help in here, please?
Yeah. Hi, my name's Sarah, I'm here to help.
Hi, so I'm just going to check if the patient's breathing. Can you wait here for a second? Thank you. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so we do have a pulse. So can you please get an OPA so that we can maintain this airway for me, please, Grace? And Sarah, can you connect some oxygen saturation probe for me, please?
Okay, stats probe is on and it's reading 78%.
Okay, thank you very much.
Offering Institute, there is no pain.
Perfect, thank you very much. So can you now connect 15 litres of high flow oxygen through a reservoir mask for me, please? Perfect, thank you very much. So now I'm going to move on to assessing the patient's breathing. So Grace, can you check the respiratory rate for me, please? And Sarah, can you please expose the chest and inspect for any abnormalities for me, please?
Just going to take this down, William, just have a look at the chest.
30 breaths per minute.
Okay, thank you.
Okay, I can't see any obvious abnormalities on the chest, and chest expansion is equal.
Okay, thank you. And can you check for tracheal deviation for me, please?
I can't detect any signs of tracheal deviation.
Okay, thank you. And now can you percuss the lungs for me, please?
Okay, you can hear a dull note at the base of the lungs.
Okay, thank you. And then can you listen to the chest for me, please?
So you can hear some noisy secretions throughout the chest, but air entry is equal, but there's also a high-pitched inspiratory and expiratory wheeze throughout.
Okay, thank you. So because of the wheeze, we want to connect up some salbutamol nebulizers as soon as possible.
So starting to go, Michael.
Okay, so can you form some suction for me, please, Grace?
Airway is now clear.
Okay, thank you very much. And Sarah, do we have any change in the oxygen saturations?
Okay, so they've come up to 85%.
Okay, wonderful, thank you. So I'll keep them on 15 litres of high flow oxygen for now. And now we're going to move on to assessing the circulation. So Sarah, can you please do a central capillary refill for me, please? And Grace, can you take a temperature for me, please?
38.2.
And central capillary flow is 3 seconds.
Perfect, thank you very much. Now, Sarah, can you check the heart rate for me, please? And Grace, can you perform a blood pressure for me, please?
The pressure is recordable. I'm just going to do a manual.
Okay, thank you.
Pulse is 120 beats per minute, but it's quite thready.
Okay, thank you. So now can you place some cardiac monitoring on for me, please, so we've got an ECG trace.
Okay, cardiac monitoring is attached.
Okay, and the trace is showing a heart rate of 120 beats per minute and a sinus tachycardia. So,
My blood pressure is 85/50.
perfect, thank you very much. So this is a patient who has a known infection and is now showing signs of worsening shortness of breath and drowsiness and has a low blood pressure, a high temperature and high heart rate. So I think that this is likely a patient with septic shock. So can we please get bilateral wide bore cannula access in the antecubital fossils, please? And once you've done that, Sarah, can you please take off some blood for me? So I'd like a blood culture, FBCs using these LFTs, clotting screen, and then once you've done that, can you take an ABG as well for me, please?
Yes, that's fine.
And once you have access, Grace, can you please run 500 ml of Hartmann's solution through stack, please?
Sorry, quite hands.
Yeah.
And Grace, as you've been with this patient earlier, do you know if the patient's had a urine output at all?
I'm not sure really, but the wife said you guys put them on this morning.
Okay, so as we have a patient with sepsis, we want to be measuring the urine output closely, so I'd like to get a catheter as soon as possible in, please. Thank you.
The 100 ml of Hartmann's gone through.
Thank you.
That's the ABG done.
So can you give that to somebody outside, please, so that they can run it and then come back and help? Thank you very much. Okay, so just want to quickly go, as we've intervened, go back and check the airway. So is the airway still patent?
Still patent.
Okay, and Sarah, is there any change in the oxygen saturations?
It's come up to 92% now.
Okay, so with the background of COPD, we want to be targeting 88 to 92% on the oxygen saturations. So I'll leave them on the 15 litres of high flow oxygen for now. And has there been any change in the blood pressure at all?
Yeah, I'm just making
And then we also want to be thinking about giving some empirical antibiotics as early as possible because we think this is likely sepsis.
blood pressure's gone up to 105/78.
Okay, thank you very much. Can we run through another 500 ml of Hartmann's solution, please? Thank you. Okay, so we're happy now with the circulation, so we're going to move on to assessing D. So, Sarah, can you check if the patient's responsive at all for me, please?
William, can you hear me? Can you hear me? So William's responding to pain with a trap squeeze.
Okay, thank you very much. So can you have a look at his pupils, please? And Grace, can you take a blood sugar for me, please?
Pupils are equal and reactive tonight.
Okay, thank you.
Blood sugar 6.
Okay, and Grace, does the patient have any history of seizures at all?
No history of seizures. No.
Okay, thank you very much. So that concludes our assessment of D. So now we want to move on to full exposure of the patient to look for any obvious bleeding, bruising, swellings, or if there are any clear fractures of the long bones. Is that okay?
Yeah.
Thank you.
Just going to take this down, William. We can't detect any abnormalities on the front or back.
Perfect, thank you very much. So as this is a patient with a known infection and the vital signs that we found, this is likely septic shock. So we've sent off blood cultures and we are planning to catheterize the patient, and we started giving fluids which has improved the blood pressure slightly. So now I'd like critical care input, so I'm going to call the ITU reg. Thank you very much. Hi, I'm Michael Smith. I'm a third-year medical student currently in the emergency department. We have a 74-year-old male who is found unresponsive by the nurse with a news of 17. He has known COPD and has been treated for a chest infection by the GP over the past 3 days. He has been brought in by his wife and son today with increasing shortness of breath and drowsiness. His airway appeared obstructed, so he opened that using an OPA and applied 15 litres of high-flow oxygen through a reservoir mask. I've given 1 litre of Hartmann's as the BP was 85 systolic and this has now come up to 105. The heart rate was also high and this has come down. The temperature was noted at 38.2, so a full set of bloods have been taken, including blood cultures. His news is now down to 10, but as this is still high, I'm very concerned. I think that this patient might have septic shock on the background of his pneumonia and therefore needs critical care input as soon as possible. We need you to come and assess him. Could you tell me how long you'll be and what I can do to help in the meantime, please? Thank you. So we have just demonstrated the management and assessment of a patient using an A to E structure following national guidelines.
Please ensure that you adhere to the policy of the local trust in which you are working. Thank you.